Okay, my genetic disorder of interest is Fragile X syndrome. Fragile X syndrome is a genetic condition causing intellectual disability. Who it affects? It affects both male and females, but females usually have milder symptoms. Statistics: how many are afflicted? It is rare. Fragile X syndrome is rare. Fewer than 200,000 U.S. cases per year. Research studies estimate that about 1 in 7,000 males and about 1 in 11,000 females. The exact number of people who have it is unknown. Chromosomes, mutations that are involved. A genetic disorder, FXS, is caused by changes in a gene called Fragile X messenger ribonucleoprotein 1, FMR1 gene, which is found on the X chromosome. The gene normally makes a protein called FMRP that is important for creating and maintaining connections between cells in the brain and nervous system. Symptoms and signs: delays in talking, anxiety, hyperactive behavior. Some people have seizures. Physical features might include large ears, a long face, a prominent jaw and forehead, flat feet, balance issues, shaky hands, memory loss, unstable mood. There are autism-like behaviors, such as hand flapping, repeating words and sentences, difficulty with social interactions. Diagnostic and tests used. FXS can be diagnosed by testing a person's DNA from a blood test. A doctor or genetic counselor can order the test. Testing can also be done to find changes in the FMR1 gene that can lead to Fragile X associated disorders. So the prognosis, it's lifespan. It's a lifespan for people with Fragile X syndrome. It's most affected people have an active lifestyle and good health. Most males with Fragile X syndrome have mild to moderate intellectual disability, while about 1/3 of affected females are intellectually disabled. So it's a lifespan for people with Fragile X syndrome, and that's generally normal. Treatments can help, but this condition cannot be cured. Treatment depends on the severity. Therapy can be used to treat learning disabilities, and medications may be used to treat anxiety and mood disorders. The current research going on for Fragile X syndrome. So gene therapy and protein replacement studies. FRAXA is funding efforts to fix Fragile X at the most basic level by reactivating the silenced FMR1 gene. We're funding groundbreaking studies using the latest technologies like CRISPR, I like to say, to restore the function of the Fragile X gene in boys and girls with the full mutation. Other important information, I would just like to say that Fragile X syndrome is the leading cause of inherited intellectual disabilities like autism. And it's not life-threatening like autism, but it lasts a lifetime.